Now I invite none other than Dr. BNR SUBUDHI, who is going to talk about the role of teleophthalmology in LVA.
Thank you, sir. So, if you have seen the last slide of Dr. Murthy, that there are a lot of issues of LVA. One thing, they people in rural area, they do not get this LVA assistance, and LVA is not a one time. It requires a lot of counseling and a lot of follow-ups also. And we doctors practicing in the urban areas, we don't have much time to go to the periphery and do this. All this can be solved by teleophthalmology. So as you know, low vision is a significant public health concern in India, with the country being home to a substantial group of world's visual acuity impaired population, and India accounts 1/3 of this population. Rehabilitation is the most important because all treatment have been finished. This includes the use of low vision aids, orientation and mobility training and counseling. This is very, very important, which we don't have much time to do that. So challenges are there. A lack of awareness and accessibility also very important. We have seen acceptance is only 35%. So help when there is no cure. So teleophthalmology is a game changer in improving the access to eye care, especially in the country like India, where a significant population people live in the rural areas and unreached areas. It's particularly impactful for low vision patients who face mobility challenges, how it can develop. Improved accessibility, cost and time efficiency, early detection, timely intervention, capacity building, and customized solutions. So already we have been explained about the teleophthalmology, which is the gap between the patients in remote areas and in the urban ophthalmists sitting in the urban areas. So they can, the local technicians, they can go and do the screening, and they can inform the doctors sitting in the base hospitals to how to, handle these cases. Cost, definitely, patient visiting multiple times to the doctor is really costly for the patient, and also the attendant who has to carry them. So probably by teleophthalmology you can reduce that. Early detection, yes, many diseases which can be prevented early by like diabetes, retinopathy, glaucoma, macular disease, all that can be prevented early. If you do, that's only possible by the teleophthalmology. Capacity building, yes, there are a lot of senior citizens also require a lot of low vision aids. Probably we need teleophthalmology with the technicians going frequently visiting them and give them the support. Customized solution, yes, for senior citizens, we have to do something for them also. So applications in LBA, all has been explained by my previous speakers. I don't want to go. But these appliances can be taken in a vehicle, either a motorbike or a mobile van, and the people, they can go take this and do the services in the rural areas. Technology, is there a lot of improvement technology? This technology can be implemented in the low vision aids for the benefit of the patients in the rural areas. I always speak because we are community ophthalmologists. So to summarize, building capacity in teleophthalmology for low vision rural areas is a transformative approach to bridging the gap between the urban and rural healthcare divide. Here some of the mobile teleophthalmology units, they can already told you about the vehicles having all these equipments can visit the rural areas periodically and give the service. Training local health workers, because local, sometimes the people available nearby the local health workers can be trained how to use this low vision aids and how to give the benefit to the patients. Community awareness, unless do awareness, they will not accept it. We have seen the 65% people not aware of this, availability of these things. So technology integration, as the research going on, science is improving, we must reach them, reach the rural population and teach them about these technological innovations. Then collaboration partner, only we, government sector or private sector, is not possible unless you involve the NGOs like Rotary Club, Lions Club, all these things, so that they can help us in the propagating the low vision aids for the people in the rural areas. They have seen Rotary and Lions have done a lot of services in the rural areas for this concern. Policy, yes, unless there is a government policy, we cannot do everything. So government has to come forward for the low vision aid for the people, because they are very expensive. It's not available, and so the practicals are not available in the rural areas. So it has to be subsidized aids, or sometimes you have to give free of cost too. And also, not a single time, we have to monitor and evaluate whether the patient is accepting or not. That is very important for the low vision aids. So only teleophthalmologists can do. So to conclude, teleophthalmology is the revolution to low vision care by bridging the gaps in accessibility and enhancing patient outcomes. Continued advancements in technology and infrastructure will further expand its reach and impact these poor people who have been deprived of the vision because of so many factors. So can we help them? Thank you.
Sir, I fully agree with your concluding remarks. Tele-ophthalmology proved a boon during the COVID season, if you all recap. It's a wonderful tool to reach far-flung areas. As Dr. Subodhi has rightly mentioned, for early detection and for providing early care to these visually handicapped people. Thank you, sir.
Thank you,
Thank you
sir.
once again.
Thank you for the comments.